This is SARS-CoV-2 and Influenza A/B Combo Rapid Test Cassette. Let's learn how to use it. First, wash or clean your hands and make sure they are dry before starting the test. Make sure that your product is valid. Materials provided. In your pack, you have test device, package insert, extraction tube with buffer, sterilized swab. The information about the swab can be found on this packaging. Biohazard specimen bag, tube stand. The 25 tests or kit package contains the tube stand, the 1 test or kit, 2 tests or kit, and 5 tests or kit package. Use the test box itself as tube stand. Materials required but not provided. Timer. Now, let's get tested. Read the instruction for use carefully. Take out 1 extraction tube. Pull off the sealed aluminum foil on the extraction tube. Place extraction tube into tube stand for box tube stand. Unpack the swab. Caution: the swab should not contact with anything else. Otherwise, the result could be falsified. Tilt your head back slightly. Insert the swab about 2 centimeters, at least with the entire soft swab tip, into the left nostril. Gently rotate the swab at least 5 times against the nasal wall. Insert the same swab about 2 centimeters, at least with the entire soft swab tip, into the right nostril. Again, gently rotate the swab at least 5 times against the nasal wall. Remove the swab from the second nostril. Caution: if the swab stick breaks during specimen collection, please use a new swab. Dip the soft swab tip into the liquid. Rotate the swab for at least 15 seconds while pressing the head against the inside of the tube to dissolve the specimen in the liquid. Remove the swab from the extraction tube by squeezing the sides of the tube together and pulling the swab out to ensure most of the buffer remains in the tube. Discard swab in biohazard specimen bag. Screw on and tighten the nozzle onto the extraction tube. Shake the extraction tube vigorously to mix the specimen and the sample extraction buffer. Open the foil pouch and take out the test cassette. Place the checked test cassette on the flat, clean surface. Caution: perform the test within 60 minutes after the foil pouch is opened. Add 3 drops of the solution from the specimen collection tube to each sample well of the test cassette. Set timer for 15 minutes. Caution: do not read the result beforehand, even if a line has already appeared at control region C. Interpretation of results. Positive result. SARS-CoV-2. 2 red lines appear. 1 red line appears in the control region C, and 1 red line in the test region T. Influenza A. 2 distinct colored lines appear. 1 colored line should be in the control region C, and another colored line should be in the Influenza A region A. Influenza B. 2 distinct colored lines appear. 1 colored line should be in the control region C, and another colored line should be in the Influenza B region B. Influenza A and Influenza B. 3 distinct colored lines appear. 1 colored line should be in the control region C, and 2 colored lines should be in the Influenza A region A and Influenza B region B. SARS-CoV-2, Influenza A and Influenza B. 5 distinct colored lines appear. 1 red line appears in the SARS-CoV-2 control region C, and 1 red line in the test region T. 1 colored line should be in the Influenza control region C, and 2 colored lines should be in the Influenza A region A and Influenza B region B. The shade may vary, but even if a faint line appears, it should be considered positive. If you have a positive result, please contact your state or territory testing services to get an in-laboratory PCR test. Stay away from other people and isolate yourself. Negative result. Only 1 red line appears in the control region C, and no line in the test region T, A, or B. The negative result indicates that there are no novel coronavirus particles in influenza A or B in the sample, or the number of viral particles is below the detectable range. However, a negative result does not rule out COVID-19 and influenza A or B. If you have symptoms like fever, cough, and/or shortness of breath, please retest in 1 to 3 days. You must continue following the applicable hygiene and distancing rules even with a negative result. If symptoms persist or if unwell, please consult a medical practitioner for follow-up clinical care. Invalid result. No red line appears in the control region C. The test is invalid even if there is a line on test region T, A, or B. Insufficient sample volume or incorrect procedural techniques are the most likely reasons for control line failure. Review the test procedure and repeat the test using a new test device. If the problem persists, discontinue using the test kit immediately and contact your local distributor. Please dispose of the test materials in a biohazard specimen bag with a household refuse. If there are local regulations, please follow them. Wash hands thoroughly after test completion.